Thank you, Brenda, and good evening, everyone. Thank you again for coming to enlighten those that are likely to die in ignorance with all the things that are happening. And I'm Pastor James Olanipeku. I'm a pastor of Christ Apostolic Church. We are based here in Poplar. And beyond that, I'm a local resident myself. I've been living in Tower Hamlets. Actually, I've been living in Poplar for almost 35 years now. So I'm a local person. And so tonight we have fantastic speakers, people that are knowledgeable, people that knows their onions to speak and to enlighten and to encourage. I know it's all about choice. However, people need to make an informed choice. And the first person I'm going to call is Shaman Banerjee.
Thanks very much, Pastor James. I'm Shaman Banerjee. I'm Director of Public Health. Pastor James, I think I might be your neighbour. I also live in Poplar, not as long as you, but I've lived there for 10 years. And my role has been to coordinate the response to COVID in the borough. So thanks for introducing me, and thanks everyone for coming today.
Thank you. Next, I'm going to call on Dr. Vanessa up here.
Thank you, Pastor James. And again, echoing Sherman, lovely to be here. So I'm a consultant in sexual health and HIV, and I'm based at Berks Health. But I also do research in race, ethnicity, and health. So it's great to be here. And I've been working a lot in terms of educating our communities. And I'm an East Londoner, born of the Royal London, and lived in Redbridge all my life. So yeah, looking forward to speaking to you all.
Thank you. I'm going to call next Adiola Agbebi. I'm going to pronounce it properly. I'm not going to say Adi because I can pronounce it well.
Thank you, Pastor James. And that is that's a great intro. And yes, you pronounced it perfectly. And that does not happen very often. So I'm a medical doctor. I trained at the London. I now, like Showman, work in public health. I work in neighbouring Newham. And I'm Assistant Director of Public Health there. I've been working on things pandemic. And before that, and now coming back to that, on diabetes prevention and supporting people to live healthily. Thank you.
Thanks, Ade. Can I call on Pastor Joshua Bandele next?
Thank you very much, Pastor James. My name is Pastor Joshua Bandele, and I'm the senior pastor of Christ Apostolic Church, Pilgrim's Tabernacle at Bethnal Green, London. And currently, I'm the youth leader of Christ Apostolic Church in the whole UK and also all the European countries. And by the role, we've been encouraging youths, over thousands of youth, and mobilizing them to see the importance and the how to encourage and to make this opportunity of being vaccinated against the COVID-19. So thank you very much.
Thank you, Pastor Joshua. Can I call on Dr. Winston Morgan?
Yes. Good evening, everyone. I am Dr. Winston Morgan from, I suppose, the local university, or one of the local universities. I am a reader in toxicology and clinical biochemistry, but just briefly, a toxicologist is someone who's interested in how you develop new drugs like a vaccine. So you'd have a toxicologist when you're developing a new vaccine to design the safety experiments and interpret the safety experiments. And over the last few months, I've been talking to people about why we know a vaccine is safe.
Thank you so much, Christine. I'm not certain he's joined us yet. I don't know. Pastor Maxwell, if you're there. Okay, while we wait for Pastor Maxwell to join, I think it makes sense for us to just go straight into the business of the day. And I'm going to just hand over straight on to Showman.
Thanks very much, Carrie. If we could just get the first slide. So I'm just going to talk about COVID in Tower Hamlets, the progress of the vaccine program, the impact on Black communities, and then I'm also going to talk about some of the common questions that we get about vaccination. And I think we'll probably be exploring them in other people's presentations and as part of the discussion as well. So just kicking off and thinking about, as Brenda was saying, how do we get back to normal life? We've all felt the impact of COVID on our communities in Tower Hamlets and in Newham. And we know both nationally and in Tower Hamlets, we've really seen disproportionate impacts on Black communities in terms of the levels of COVID, severity of COVID on families and individuals. And we know that if you have a population that's unvaccinated and if you don't have lockdown measures, COVID levels rise really quickly, and COVID has a potential to have a lethal impact, and that COVID picks out the most vulnerable people in our communities. We're also we're facing rising levels of a new variant of COVID, the Delta variant, and that's more easily transmitted. Although it's really important to say our vaccines are highly effective against this variant. And so what we need to do is we need to work together to just address this cycle that we've been facing since April last year or March last year of successive waves of COVID and lockdown. And we need to take measures to get back to our lives and do the things that we enjoy. But this does mean a new normal. So what is normal now is, and looking ahead, is to be vaccinated. It's to get tested regularly, and if positive, it's about isolating, and it's about isolating if you're a contact of a case. That is something that we've all been getting used to. And the issues around hand space, face, good ventilation, those are not likely to go away after the step 4 of the lockdown. They will still be issues that we'll need to think about. And so vaccination is a real critical part of all that around getting back our lives. And we know that if you get 2 doses of the vaccine, your chances of getting COVID are reduced by at least 80%, and your chances of severe illness are really minimized, and you're also less likely to pass COVID to your family and friends. So to get the full impact of this vaccination program, we need to work together to get over 90% of our communities vaccinated. So Carrie, can I get the next slide, please? Thanks. So I was just going to say a little bit about progress in Tower Hamlets. We've vaccinated 162,000 residents since December with their first dose, and 80,000 have had 2 doses. We need to vaccinate around just under 300,000, so we still have some way to go. We have one of the youngest populations in the country, and I think it's similar for Newham as well. So 6% of over 65, 65% of our population are over 65 compared to 21% nationally. So we have a real young population. And what that means is that a higher proportion of our residents have only recently become eligible to be vaccinated. So we have some distance to go. At the same time, I think it's important to say that if you look at the age bands and compare age bands for the over 40s, the uptake of our vaccination rates are not that different to London as a whole. So it's not as if Tower Hamlets has significantly higher levels of what people call vaccine hesitancy than the rest of London. But as Brenda was saying, when we look at the figures, the uptake of vaccination is about 10 to 20% lower in Black African and Black Afro-Caribbean communities. Can you just get the next slide, please? And sorry, this is a bit of a stripy slide, but it's just to make the point. If you just focus on the sort of the brown columns and compare them to the dark green columns, what you can see is that across all the age bands, the uptake, so green bands are Black African groups. Actually, the lighter ones are Black Afro-Caribbean, but if you just focus on the Black African, you can see that for all age groups, uptake is lower. And particularly if you look at some of the, the more vulnerable groups, the 80 to 90-year-olds, you can see that it's significantly lower than the Tower Hamlets average. So that's the issue, obviously, that we're exploring today. What's your next slide, Carrie? So why is this? So what are the barriers? So just there's some things about the vaccine itself. It's worries about the side effects. It's about getting clear, reliable information. There's a lot of issues of trust in the vaccination program, but trust in health services more widely. And then I've just put in a text box which kind of reflects some of the themes that come out of our focus groups with Black African communities, and the issues about facing poor treatment or being treated differently through health and care services, misinformation, the need for communication which works for communities. And also, I think one that's really important is that people don't want to feel like they're being forced or told to take the vaccine. It needs to be an informed choice. So those are some of the barriers. There's also barriers around just the access to the system, which are actually from all communities, which is about the confusions around the booking system. You can book through your GP or you can book nationally, and that is a source of confusion. Obviously finding time, and that links to the need for convenient, familiar, accessible locations. And then there are some real issues around registration. You kind of need your NHS number to book online, and you need to be registered. Well, it helps a lot if you are registered to a GP. We held a clinic last Saturday in which we asked people just to turn up. We targeted the communications particularly at people who may not be registered. And we had 1,000 people queuing up to get vaccinated, and around 80% of them were unregistered. So that shows how people get lost in the system and how you need to make it as simple as possible for people. The next slide, Carrie. These are some of the common questions which do impact on people's decision to get vaccinated. So pregnancy has been an issue, and in the initial stages, because of the lack of evidence, it wasn't evidence that it was harmful, there wasn't enough evidence around safety in pregnant women. It wasn't initially offered. But because of the evidence from the United States, in which thousands and thousands of pregnant women have been vaccinated, it's now advised that pregnant women should be offered the vaccine. Also, women concerned about breastfeeding and a little bit hesitant if they're breastfeeding, should they be vaccinated? And then the advice is that you can have the vaccine if you're breastfeeding, and actually vaccines don't pass through breast milk, so it's safe to breastfeed and also get the vaccination. there are a lot of questions about the impact of the vaccination on fertility, and there is no evidence that it has any effect on your chances of becoming pregnant, and the vaccine also can't give your baby COVID. Also issues about actually what does a vaccine contain, and for some communities really important that it doesn't contain any animal products. There have also been a lot of concerns about people with existing health conditions who've been worried that the vaccination actually makes their health condition worse. And the key message we've been looking to get across is that if you do have a health condition, it is even more important that you take up the vaccination, because if you do get COVID, that may have really significant impact, and there is no evidence that it will make your health condition worse. So that's an important consideration. Also, a number of second dose issues. So one of the things that people worry about in getting their second dose is that if they've had a really difficult experience with side effects the first time around, they're worried that they're going to get it the second time round. And you can't say that they won't, but actually in general, the side effects are less marked the second time around, but it remains possible that you can still get significant side effects. And then people are also have been asking questions about, does the second dose need to be the same type of vaccine as the first? So people who might have had AZ vaccine for the first dose been asking, do they need it the second time around? And the answer is yes, because the vaccines haven't been tested in a way that enables you to mix them. So that's the message. Let's just get the next slide, Carrie. And then just kind of what is it that residents want, in terms of from our engagement with our communities. People want positive media stories, people want personal stories, people want to know how the vaccine is rolling out. And it has been reported actually this week, the extent to which the extent of vaccine hesitancy has fallen since the start of the vaccine program, and that's probably linked to millions of people getting the vaccine safely, and that being a positive thing, not getting COVID. So that progress on rollout and those stories about people who've had the vaccine and not, and that being a positive thing are important. Residents, as I said before, want easier access, more convenience, more pop-ups, GPs, centres, pharmacies, walk-ins, and so there's a range of things. People, different things will work for different people, and so that's what people are asking for. A lot of requests around actually reliable, factual information from trusted sources about why the vaccine is important. And then inclusive advice and support. So advice that that is tailored around people's culture, languages, and then also there's an ask particularly linked to what I was saying before, advice for people who have existing health conditions. I'll just get the next slide, Carrie. So I just wanted to quickly go through just in Tower Hamlets, how you get your vaccine. And I think it's important to say that, as the program is intensifying, more things are coming on board. So it's important just to keep updated on what is available. But I think probably the most important thing is that we have really significant walk-in options now. So in the Art Pavilion in Mile End, near Mile End Station, Shadwell near Shadwell DLR, Cable Street Surgery, they are now, if you're 18 or over and you need your first dose, you can just walk in, no questions asked, 7 days a week in the Art Pavilion, and then Monday to Saturday in Cable Street. So that's really important message, that if you're 18 or over, need your first dose, you can just walk to these centres. You can also book online. You may get a text from your GP, and if you follow the link, you'll get booked into the Art Pavilion or Cable Street surgery. Also, obviously, you can go online through the national portal and book into Westfield. Our pharmacies, Lincoln Pharmacy, which is very popular, and Lansbury in Crisp Street and Poplar. And also the East London Mosque, which now has a weekly clinic. And also a lot of people are being booked into Guy's and Thomas's, which is just on the other side of the river. So a lot of options there. And as I say, we're continually expanding our settings for our vaccine clinic. And I think Carrie's just added this QR code to keep up to date. So thanks for that, Carrie. I think it's Carrie. And then if I could just get the next slide. And then just a few things about after the vaccine is important. A lot of people go, what can I do? Can I do I still need to follow the restrictions? And it's important to recognize that although the chances are lowered, you can still pass on the virus. You can still be infected, particularly in the first 2 weeks of getting your first dose. So really important to take those measures that we're all used to: social distancing, face mask, hand washing, ventilation, and then self-isolation, etc. So those are still really important. And then just the last slide, Carrie. So just to say that, if you're unsure about anything, you can call our helpline. So since February, we've had a helpline, multilingual helpline, and it's been really helpful for people who just had queries. It can also get you, it can talk you through the options, and you can get supported to have your vaccine appointment booked, whether it's through the national system or through one of our local centres. So that's really important, and it's helped thousands and thousands of residents through this time. So thanks very much, and I'll stop there.
Yeah, that was very helpful. At least you have spoken a lot about the ease of being vaccinated and all of those things. Thank you. I'm just going to go straight to Dr. Appiah, and I'm sure she's going to talk to us about things that may be affecting, especially the younger one. And I'm sure she'll have a lot of answers to all of their apprehensions. So over to you, Vanessa.
Thank you, Pastor James. No pressure on me then, but I will try. No, thank you. And thank you to Sherman as well, because Sherman gave a really good overview of a lot of the reasons why we need to be taking the vaccine. But what I wanted to do was really talk about, from my point of view, in terms of why I really have come front and center with many of my colleagues here about talking about the vaccines, and why I'm so invested in it. And I think, first of all, it's been said a number of times, but we're here for informed choice. Like I said, this community is my family, and I always say to them that I'm not here to bully you or to tell you to take the vaccine, but if you're not going to take the vaccine, make sure you've not taken it because after knowing everything about it. And often, most times, when people do know the information, then they make the decision to take the vaccine. And I think that all of us on this line today, that's been one of our guiding forces. The other thing is that as a medic and working, it's interesting because my specialty is sexual health and HIV, but within COVID, we all got redeployed to work in and look after those living with COVID. And I have to say, when you see that, you're desperate for a vaccine, and we were so glad to have the vaccine. But for me, one of the hardest things within COVID has been who it has affected more. And it was very clear from early on, and we are still seeing it, that those from minority ethnic populations, those of Black African ethnicity, those of Black Caribbean ethnicity, those of Asian ethnicity as well, and with all the different subgroups, have experienced poorer outcomes from COVID-19. COVID-19 is a terrible disease. And it's not just because in the acute phase, because you can get it and you may not have any symptoms. You can get it and then have some symptoms, but feel, okay, I'm moving around fine, it hasn't really fazed me. Or you can get some really severe symptoms. And it's really interesting because some of the complications that we talk about from the vaccines that have come up, and I'll talk about it later in terms of blood clots, etc. The thing I always say is that the risk of getting those complications from COVID itself is far higher than you getting it from the vaccine. So consistently, COVID is far worse than you taking the vaccine. And so the vaccine trumps. The benefits of the vaccine far outweigh the risks of the vaccines. And the other thing is that it's been emphasized earlier, but we're in a pandemic where we are most at risk. And then it's about, okay, how do we get out of it? And vaccines are key to that. And what do we want to do? We want to make sure that if we are recognizing that we are the populations that are being hospitalized, we are the populations that are dying from COVID, then we need to be the ones that adopt the protection from it. And vaccines are key to that. They are not the only answer, I'm not going to say that, but they are part of our armory so that we can move forward and be protected. And it's just emphasizing that those that are vaccinated are even more likely to get, to get serious, the serious complications of COVID-19. They are less likely to be admitted and less likely to die from it. And also, we are learning that whilst if you are vaccinated, there is a possibility that you can get COVID, but the COVID that you will get will be far milder. There is a possibility that about passing it on, but if you are vaccinated, the risk of passing it on is less likely. So it's not foolproof, it's not 100%, but it's all about reducing the likelihood. And I think that's what's really important. And we can't just think in black and white. We've got to think about those gray areas as well. And when people say to me, okay, who should get who do I think should get the COVID vaccine? Everyone. And I think when we think of those now, as we said, that within our boroughs, we have got much younger populations. And the battle I have at the moment is, even though I like to think I'm young, but no longer anymore. So when my younger members of my family will come to me and say, oh, but we're lower risk, why do I need to get the vaccine? What I say to them and what we are seeing, and I think it's really important to emphasize, we are seeing more cases of COVID and we are starting to get hospitalizations. And those that are being hospitalized are those of a younger age. They are those that are not vaccinated. And if they are vaccinated, more of those that are being admitted are those that have only had one dose. So again, it's reinforcing that it's so important. But when you are younger, so people say, oh, okay, I've got less of a risk of dying or becoming seriously unwell from COVID. But what I say particularly is about the phenomenon of long COVID. Long COVID is real. Long COVID is having the effects of COVID far longer after you've even contracted the virus. These symptoms can be so debilitating. So it's physical, it's mental health, it's memory. And I have witnessed colleagues and friends who are, I describe them as Duracell bunnies. You know, before COVID, they were energetic, always on it, getting out there. And right now, some of them have not been able to come to work for at least 10 months. So the effects of long COVID cannot be underestimated. And if you get a mild form of COVID, it doesn't mean that you're definitely not going to get long COVID. In fact, what we're seeing is people that have had mild cases of COVID or didn't have any symptoms at all are getting long COVID. So what do we say? You want to stop the risk of long COVID. So how do you stop it? It's getting vaccinated. The other thing that I wanted to emphasize is about the issue of pregnancy and fertility, because I know that Sherman touched on it, but it's something that is becoming a regular feature in those that I'm seeing. And we are unfortunately seeing a number of people that are pregnant being admitted with COVID in this in these past couple of weeks. And it's so important to emphasize that in the beginning, when we were rolling out the vaccine, there were specific groups that we said were more at risk. And so we said that initially, not all pregnant women should have the vaccine, or only those that would fit into those risk groups. But as we've moved on, and as each priority group has been seen, what we've said is that if you've been called to have the vaccine, if you are within that group and you are pregnant, you should go and have the vaccine. And so right now, where we are, anyone who is pregnant should go and have the vaccine. Now, I'm always asked, can I be sure that there is going to be no complications? How do I know? Because we haven't got that data. What we can say, first of all, is that the impact of getting COVID in pregnancy can be catastrophic. And so the risk of you getting any complications from the vaccine are far less likely than you getting complications from having COVID within pregnancy. Sorry, I'm stuttering my words. So the key thing is that you do not want to get COVID within pregnancy. And also the other thing is about COVID and fertility. And there's these claims that are out there, I just want to reinforce, they are unsubstantiated. There is no evidence looking at the pathways that this should affect any fertility. And I have had a lot of people come to me about there's concerns about the spike protein and immunity to the spike protein that can lead to fertility problems. This has not been supported by evidence that we have. And so again, if someone is attempting to get pregnant or is currently pregnant or is breastfeeding, please do take the vaccine. I feel that many other people are going to speak, and I'm just going to end there, and I'm really open for questions. But I just want to say that for me, vaccines are not the only way of protecting the community, but where we are now, we've got hands, we've got face, we've got space, ventilate, and vaccines are key to adding to our armory. And also the key thing is that we need to be resilient for what is to come, and vaccines are at the root of that. So I'm going to stop there, and then happy to have any questions afterwards.
Thank you so much, Vanessa. That was actually very explicit. And I hope many people will get to hear this, even if they're not here, they get to hear the aftermath of it. One thing that is so true of us, when I say us, Afro-Caribbean, is we are a tough nut to crack. When opinions are formed, it becomes so hard to convince, but once we are convinced, we don't look back. And so I just want to pass on straight to Dr. Morgan, who is going to talk to us about a little bit of what I've just described, because I know whatever has been happening is historical. And so we just want to hear the context to that. So over to you, Winston.
Thank you, Pastor. Yes, so I'll talk about the historical briefly, because there's so much of it that I could go into. Historical reasons that might make Black communities in particular more hesitant towards the vaccine. But that's a narrative. And the reality is, when you think about vaccination, everyone initially is hesitant when a new vaccine comes along, and then they have to be persuaded by trusted messengers that they should take it. And one of the reasons why people are generally hesitant about vaccines is because of the uniqueness of vaccines. And I'll come to the historical bits in a minute, but I think it's really important that we make it clear that we understand why people are hesitant. So to be an effective vaccine, it has to have some of the components of the pathogen, in this case, COVID-19, in it. And that makes people worry. And, so there has to be no question about safety. So to overcome this, we need trust. Trust in the government, trust in the NHS. I think one of my colleagues mentioned this. Otherwise, vaccines are a really hard sell. And many communities, particularly Black communities, have historical reasons why they have less trust, both in the government and in the NHS. And as I said, these are from both their current lived experience as well as awareness of historical racism. They know, for example, in terms of their current lived experiences, that they haven't always been at the front of the queue when it came to handing out, delivery of medical services. So why suddenly are they being, encouraged to take a vaccine when previously they were ignored? That's one argument. And one of the things I always say, you must use your agency. You must be able to see the evidence, see the information, and then make an informed decision. So going back to the historical reasons, these would have started from, if you like, the use of enslaved people perhaps in North America to do experiments. One of the famous ones is someone called Dr. Marion Sims, who's known as the father of gynecology, and he actually experimented on enslaved Black women. So those kind of things, people remember them. They're all part of our historical memory. Another one people talk about is the Tuskegee study, which ran for over 40 years, in which basically it was supposed to be a study involving the treatment, natural history of syphilis in Black men. And for taking part in the studies, they were promised that they'd receive free medical care and meals and that kind of thing. And they were monitored, and they were only given placebos. And even when a treatment for syphilis came along, they weren't given it. Now, when you're doing something ethical, when you're doing a clinical trial, if a new medicine comes along that works, then you give it to the patients. You don't leave them on it. And that was the unethical thing. So there have been historical reasons why Black people would not trust medical scientists and doctors in the past. Another example is, I don't know if you've heard of Henrietta Lacks. She was a Black woman who had cervical cancer, and before she died, they took some cells from her and they used the cells for experimentation. And what we scientists found was these cells are really good for doing experimental studies. And so what they did then, they basically went to her family and got all her medical records and their medical histories, and they used that to, do further studies, but they didn't tell the family and they didn't get any consent. So again, it's this idea of unethical practices amongst Black people. So, and it took until about 2013 before the family got control of her medical history and the cells and that kind of thing. So those are examples. There are other examples in Africa where people have sort of tried. For example, there's been malaria drug trials that they haven't been done in the most ethical way. Some of you may have heard about the Pfizer company and the meningitis drug that people have tested. And some argue that this was done unethically. So there are lots of reasons why Black people will instinctively not trust the medical services. But I go back to the idea of agency. And with agency, those historical things, you have to be aware of them and you have to know about them. But the difference with the vaccine is this time, everyone is being offered the vaccine. There's nothing hidden. There's nothing secretive about it. We're all equally being offered it. It's been tested in all types of people. So it's not been tested in you. In fact, it's now being given to over 800 million people. So we know if there are any safety issues with the vaccine, it would appear. And I think I'm going to stop there because, again, like Vanessa, if you have any specific questions, I'm happy to answer those. But just to say, historical reasons may have been made you think twice about taking the vaccine, but having looked at those historical reasons, there is no comparison. We're being offered the vaccine on an equal basis, and it's safe for all of us. So thank you very much.
Thank you so much, Weston. That's very good context to the background. Well, we have a couple of questions in the chat room, and questions that have been sent ahead. I want us to, as much as possible, do a lot of justice and justices to it. But perhaps I just want Vanessa to just start to kick off with this question, because it's one of the questions that have been sent as well. The younger ones will say, okay, you said, even if I take the vaccine, I'm not safe and I can be infected, or B, why should I bother? What's the essence of it? So, Vanessa, what you will be telling such people asking such questions?
No, thank you, Pastor James. I think I would just emphasize that as I said earlier, a lot of younger people think, okay, the risk of me getting more severe disease or dying from it is not an issue, so they don't think the risk is high, so they shouldn't consider it. But I say two key things. I say for them that they do not want to get COVID in any form, and there is a risk of getting long COVID. Just because you've had milder symptoms or no symptoms, you can still get long COVID. But the other thing is that I always emphasize is that what we've learned about COVID and everything, it's not just about you, it's about your wider community as well. And so you having COVID but having a milder form and you still potentially passing it on could go on to someone who actually could get severe disease and could die from it. So we are all, it's that whole saying, we're all in it together. We need to trust science together. As Dr. Morgan said, we're all equal in this at the moment. And so we have to trust it together, but then we also have to take it together to protect one another. So that's what I would say.
Okay, while you're still on there, there's a question here from David on the chat room, and he says, what do you say to young women who fear the vaccines affect menstrual cycle?
Yeah, no, thank you. So I think what's really important is that throughout when the vaccines are being rolled out, it's been really key for people to feed back any symptoms or concerns that they have, because we need to learn from it. We're always gathering information and data about it. Now, what some people and some women have reported is that after taking the vaccine, sometimes they found that their periods have become longer or heavier. And some people have noticed other changes within their cycles. Now, when these reports come in, they've been put together, looked at, and at the moment, there does not appear to be an association between vaccines and menstrual cycles. So, but we recognize that people are reporting it. And what we do say, I say to women that one of the things is that our menstrual cycles change for a number of reasons. And within COVID and being in a pandemic and the stress in itself, that can also affect your menstrual cycle. So if you've been stressed just before having the vaccine, that can be one thing. The other thing, though, is that we are monitoring and investigating, because we look at when we look at the uterus and we look at the ovaries and gynecological tissue there, they can have immune responses. So we are looking to see, can we see an association? But right now we can't. And also just to say that the women that have been reporting these concerns, it's been short-lived. So it's not something that has been extended, and that's really important. But do feedback, but I just say to women, please, regardless of that, go and get your vaccine.
Thank you, Vanessa. Can I ask Adil like this? It's another question from on the chat room. What's the impact of the vaccine on people with compromised immunity living with HIV or on cancer treatment?
So that's a really good question. Vanessa also might want to come in around this. So there's the thing with, as Showman said earlier, that a lot of people who've got pre-existing conditions raise concerns that the vaccine is going to make their condition worse. And there's, as Showman also said, that there's no evidence that this is the case. The vaccine is actually going to, for the most part, protect you against COVID, and COVID plus those conditions leads to very bad outcomes indeed. There will be, the way that vaccines work is, as Winston said, that you get a little kind of marker of the disease for your immune system to make a reaction against. It's so that your body recognizes that disease from just the smallest part next time it sees it, and can swoop into action and mop it up and get rid of it from your body much more effectively. if you have some conditions where your immune system is not working properly, or the treatment you are taking for the condition, so for example, if you're on chemotherapy for cancer, and that will kill a lot of your immune cells. If you're HIV, if you're not on ARVs, and please be on ARVs, they're a very effective medication. But if you've got low CD4 or T cell counts, you're not on your ARVs. It means that you don't have, as your resting state, a good functioning immune system. And that therefore means that for any vaccine, it's difficult for you to make a really strong vaccine response, so that you should have the vaccine and get your immune system to do what it can do, but you shouldn't just rely on it. But it won't make your underlying condition any worse, but it might not give you the same protection as everybody else. As Sherman said earlier, that for those people particularly, and the people that were shielding, but for all of us, for the next few months, we need to be doing everything. We need to be doing the COVID safe basics, all of that, staying 2 meters, avoiding crowded places, hands, face space, opening a window, making sure you're outdoors as much as possible, particularly if you're doing anything social. We need to keep doing the testing, doing the kind of testing if you're asymptomatic, or if you think you've got symptoms that you think might be COVID. And we need to get the vaccine. The other thing that it's worth sharing, I think, with people who are listening in, is that I know that Tower Hamlets got the helpline. Newham we have peer supporters, and we have a web link and a phone line for people who've got questions about the vaccine, but we also have the Covid-19 helpline, which is 0207 473 9711 for residents of Newham, which is your connection to advice about what to do if you have to isolate. And so we've got lots of people. We recognise it's economically difficult for people, but if you've been pinged by test and trace as a contact, or if you just tested positive, we've got support to help you isolate as well. So short answer for those questions: you should still have the vaccine if you've got HIV. You should still have the vaccine if you've got a cancer treatment. If you've recovered from cancer a long time ago, congratulations, you should still have the vaccine. But just bear in mind that if you've got a limited immune condition, that you may need to take additional precautions.
Okay, thank you. There are some advanced questions that were sent. Brenda, if you can, please.
Yes, thank you. Thank you, Pastor James. So yeah, before we move on to our next speaker, we have a question that I think is quite appropriate to ask now. And I think, Winston, you may be the person for this one. The question is, why can't we build up our own antibodies for the coronavirus? Or can we?
Well, do you mean by getting yourself infected without having to? Well, effectively, that's what the vaccination does. It allows you to build up the antibodies against the virus without the pathogenicity of the virus. That's the whole idea of vaccination. You either weaken the virus. That's how it was done historically. People got weakened viruses or kill viruses or bits of viruses, and so they weren't able to grow and multiply in your bodies. So the answer is yes. That's exactly what we're doing. We're building up our own antibodies. But with the vaccine, there's no danger of the virus going wild inside your body, if you like, because that's what happens when you're infected naturally with COVID. There's a race on between your body protecting yourself from the virus and the virus growing and multiplying and damaging your tissues and organs. But when you have a vaccine, you take away the danger of the virus doing you harm, but you get the same immunity over the long period of time. I hope that's what the question was about. Yes, so effectively, that's what a vaccine does. It allows you to build up your own antibodies.
Great, thank you, Winston. And I think actually just one more, and this is to Sherman. Why is the vaccine so important if it's not proven to work 100%, and we might have to have more injections in the future?
Thanks, Brenda. So just to add from kind of what we've been saying already about the effectiveness of the vaccine and its importance in terms of protecting yourself and protecting others, I think I just shared just the observation in Tower Hamlets and also elsewhere, which is that we monitor the levels of COVID every week. In particular, the particularly important is the levels of COVID in the over 60s population. because that's the group that's particularly vulnerable, and we know that they were the group that were typically hospitalized and had really severe illness. What we observed, and I was personally surprised at how quickly this happened, but when we got to the point at which most of the over 60s were vaccinated, the levels of COVID absolutely plummeted. And we've had weeks in which we've had no cases of COVID in the over 60s population. And so what we see now when we look at cases of COVID in the population is that they are in the unvaccinated populations. So yes, our COVID levels are rising. And when you look at it by age, it's particularly the 19 to 24-year-olds who are getting COVID. But what we are not seeing is hospitalization and significant illness anywhere near the extent to which we've seen in previous waves. So that's evidence in our borough and across the country about what the impact of the vaccine has been and how it's reduced the impact of infection in the most vulnerable groups. So I think that's why it's really important. And then, but as I think the person asking the question said, it's not, it's not 100% effective, but it still is highly effective. But one of the things that we don't know going forward is if we do get variants, one of the key things that we look at with variants is their effectiveness against the existing vaccinations. So we will always need to be vigilant about this. There's likely to be a booster program, just as there is for flu vaccination. That booster program, that vaccine, people will continually be adapting and researching the vaccine to make sure that it's as effective as possible against any strains of COVID that are out there. So, so I hope that answers the question.
Thank you, Chairman. Pastor James, shall we move on to our next speaker?
Yes. Thank you, Brenda, and thank you everyone for those answers. I'm sure they are helpful, and I hope will continually be helpful. So I'm going to move straight to our next speaker, who is Adiola Agbebi.
Thank you, Pastor James. Thank you, Pastor Max. So I'm just briefly going to cover what are some of the things that we've been doing in Newham. In Newham, we've looked at COVID as needing COVID vaccination as needing a village to vaccinate a borough. And we have a lot of people supporting the NHS to roll out vaccination. We're also mindful that that we know that it's not necessarily about hesitancy. It's about, as Winston said earlier, some people have different issues accessing the vaccine. There's a lot of people that don't have NHS numbers, and we've worked really, really hard with a lot of our partners to come up with systems and processes to support everyone to be able to get their vaccines. We have a number of community sites. We have, I think, about between 11 and 13 community sites that are open 1 day a week. They're in a church near you, a mosque near you, a temple near you, a sports centre near you. I'll bring up a little map in a moment, just showing you where they are. We have 14 voluntary community and faith sector groups who are working with us to do some training on social media, to have peer support training, who are there to go into communities to have supportive conversations around the vaccine. We recognise that people have questions. We also recognise that some communities seem to receive far more misinformation online and videos and content that are echoing concerns and perhaps echoing concerns that aren't founded as factually well as they could be. We've got lots of people available to have conversations in a whole range of languages. We've also been looking at working with our rough sleeping people who sleep rough. and people who don't have recourse to public funds, so people who've arrived in the borough, haven't been able to register with a GP, have got unclear status legally. It's really important that everybody has the same opportunity to get themselves protected against COVID through vaccination and through support to be able to isolate if they are exposed. So we were working hard with our partners on all of that. And again, the COVID-19 helpline is the first point of contact to come and to ask your questions about COVID and about support around isolation. Our data shows, and Showman shared some data from Tower Hamlets, but our data shows that, again, we're not doing too badly on the number of people who where there's uptake, but it's not equal. And we have, I think I could say 2 weeks ago when we looked at the numbers that were coming back from the NHS and from our GP partners, we've got over 1,000 people who are of African or Caribbean descent in the borough who have got clinical conditions that will put them at risk of dying if they have COVID, who haven't had, who aren't recorded as having a vaccine yet, first or second dose. So I would urge you, if you know someone who's in that position, connect them with a peer supporter, start the conversation yourself. If there's questions or fears, absolutely start those conversations. I think Winston said something that earlier that I've also been musing about, that, you know, a lot of people don't like vaccines because it involves a needle. Again, I've got some really lovely stories from our GP-run vaccine centres and from community sites about how people who are frightened of needles have been supported to have the vaccine. And it's been supported in a way that works for them. We've had people who have conditions that make them particularly nervous around this, who've never had a vaccine in their life, who've come to one of our community pop-up sites and successfully been supported to have this particular vaccine. People who are young, in their 20s, people who are old, up to 100, who've been able to take the vaccine because the support that they get on site, where everybody's lovely, everybody's kind, you can take your time. If you want to have somebody to go in with you, you can have that. If you need to bring a family member, you can have that. If you need to have a blindfold, you can have that. If you need to have your favorite soothing, you can have that. We really are keen that everybody gets the support that they need. If you don't have an NHS number, if you're not registered, if you're worried about your legal status, that's also fine. If you go to a community site, that we don't ask questions, we just want to give you, as I think all of us in public health, we're interested in reducing health inequalities, we want to give you the best access or the fairest access to the vaccine so that you can protect yourself and your loved ones.
Thank you so much, Adeola. And on that, well, it's nice you've ended it on that note. Caring about your loved ones. And that's why I'm going to bring on Pastor Joshua, who is going to speak just about that you just said. Over to you, Pastor Joshua Bandele.
Yes, thank you very much, Reverend James. And I want to appreciate all the panelists and all the speakers for these enlightening messages. And I call it a means of empowering community. I have the privilege of leading the youth of our mission in Great Britain, the United Kingdom, and almost all the parts of the European country. And one of the challenges we have is about the perspective, the view, and the understanding of the younger ones, most especially the risk they are bringing to the family. It's very unfortunate that many youth of nowadays, with the level of technology, social media privileges, and the level of educations that they enjoy, we still have lots of youth in our community, most especially from the African and Caribbean community, still believing that it is wrong to be vaccinated. And as a pastor, and also somebody that works within the pastor a church in a community of hamlet, and I've come to realize and to understand that failure to be vaccinated and to get the vaccination is simply putting the family at risk. And over the last 1 year, COVID-19 has profoundly changed our lives. It has caused a lot of tremendous and human suffering and the challenges, most basic foundation of societal well-being. and in terms of social distances, not handshaking and not hugging, and so on and so forth, and the inability to gather together and to have our social life, the purpose of our human community, that is to relate with one another. And because of the immediate impact of this pandemic, the way it has affected the health, the jobs, incomes, anxiety is building, and the worry and fear is rightly increasing. And that is why we have in family, from my experience, and when I have the conversations and the counseling and encouraging youth, family, we've come to realize that the impact of COVID-19 on family is it's highly risky, and the most especially family and the child risk factor, how it has affected the relationship in the family, and the inability for parents to care for the children, and to care for those who have disability challenges, and the conflict and separation within the family, and also family violence has really increased. And we've seen the parental substance misuse. A lot of people, a lot of young adults, young couples have fell into hard drugs and social manners and the challenges and the problems as such as drugs and so on and so forth, and the abuse of drugs and so on and so forth. And then we also see the parental unemployment. And this pandemic has really affected the financial incomes of family, financial stress, financial crisis, and the housing problem, and the inability to meet basic need within the family circle. And the most important one is the mental health and the exposure to stress. A lot of family, young couples are going through mental challenges, mental problems, and they have been exposed to stress. And for that reasons, one of the things I will just mention or raise is how to deal with the behavioral view. Number one, if young people don't get vaccinated, it could leave everyone vulnerable. So we need to mobilize our family, friends, our loved one, and members to get vaccinated in order to protect ourselves and to protect our family, to protect our community, and to protect the elderly ones and the elderly people in the community. And also, as rightly said, COVID-19, if it has not killed us, is a privilege. Then we must not put ourselves at risk to go through unnecessary death. We can manage it by going through what has been mentioned, like social distancing and so on and so forth, all the rules in order to prevent spreading of this pandemic. And also, when we look at the behavioral view, that is, I'm talking about the social benefit of vaccination. As earlier as possible, we get vaccinated, we encourage, we mobilize, most especially family. And let me focus on the younger, the youth one. The earlier we encourage, the earlier we get vaccinated. That's the earlier we come back to rebuild our society, to rebuild our community, and to rebuild, to take back our social gathering, which has been taken away by this pandemic. And also, we need to understand the highlight of social norms about vaccination. It's very unfortunate that we are in a society that, with the level of amenities, civilizations, and so on and so forth, we can still believe to doubt the strength of the leaders, the government, and the community leaders, and most especially a lack of trust for the scientists, for those who are in the medical field, and because that's what they were trained for. And it's simple as, for example, I was telling somebody who was complaining about, I don't trust the scientists, I don't trust the vaccination, I don't trust this, I don't trust that. And I said to that person, do you love traveling by air? And the guy responded that I love traveling, going on holiday. I cannot wait to start traveling around the globe. And I said to him that, do you know the pilot that is piloting the plane? Do you know why do you trust? Is that that's what he was trained for? So if we can trust the pilots that fly our plane, then we should encourage younger one, family, most especially the African Caribbean, to trust the credibility of the scientists, and we should trust the NHS, and we should recognize the wonderful job that they've done in order to bring our community and our society back. And also, we have a responsibility also to trust our leaders. Even scripturally, as a Christian, Bible says that we must respect, we must give honor. Honor simply means trust, obedience to the instruction of leadership. So we need to emphasize about the importance, how this has affected the family at large. So people are more likely to get vaccinated if they believe that COVID-19 is a serious issue. It's not a myth or mythology or fallacy. It's something that is real, that is true. And the way people have fear, please permit me to mention like cancer and so on and so forth, sicknesses and diseases in our community. People need to come to realize that COVID-19 is also dangerous, it's also pandemic, it's also it's evil, and it can cause havoc. So since young people are less at risk of developing trust for COVID-19, we need to highlight and the potential of long-term consequences of this this pandemic in our society. And that gratefully, the lockdown is being removed gradually, and we are struggling, and that's the desire of each and every one, to have our life back, and that is to relate, to mingle, to interact, and our social gathering, and so on and so forth. Then we need to get trust and this done, that is mobilize, encourage, and lay emphasis on the impact of this vaccine in our lives, how it works and how it protects, and the prevention is better than cure. So that's what I will say, that with the effects on the family, as rightly mentioned, like the mental issues, mental problem, exposure to stress, and a lot of families are struggling in the area of housing and the inability to meet their basic needs, and so on and so forth. And most especially the area that younger ones are taking solace and comfort in hard drugs that damage lives, that damage destiny. We need to buckle up and encourage family, younger ones, that we all need to go out and get this done by making ourselves available to be vaccinated. Thank you very much.
The younger ones will say, okay, you said, even if I take the vaccine, I'm not safe and I can be infected or be, why should I bother? What's the essence of it? So, Vanessa, what you will be telling such people asking such questions?
No, thank you, Pastor James. I think I would just emphasize that as I said earlier, a lot of younger people think, okay, the risk of me getting more severe disease or dying from it is not an issue, so they don't think the risk is high, so they shouldn't consider it. But I say two key things. I say for them that they do not want to get COVID in any form, and there is a risk of getting long COVID. Just because you've had milder symptoms or no symptoms, you can still get long COVID. But the other thing is that I always emphasize is that what we've learned about COVID and everything, it's not just about you, it's about your wider community as well. And so you having COVID but having a milder form, and you still potentially passing it on, could go on to someone who actually could get severe disease and could die from it. So we are all, it's that whole saying, we're all in it together. We need to trust science together. As Dr. Morgan said, we're all equal in this at the moment. And so we have to trust it together, but then we also have to take it together to protect one another. So that's what I would say.
And thank you. We're grateful. I hope many hear this and they have a change of mind. We have several questions that we have answered, and we still have more to answer. So there's a question That's an advanced question that was sent, and actually it was actually directed at Pastor Max. I wonder if Brenda would want to read the question so that Pastor Max can give an answer.
Yep, I'm happy to read the question. So the question is, why is there a negative perception of the vaccination amongst prominent faith leaders who are teaching falsehoods to their congregations? And what are you, and I think the question is you as in faith leaders, personally doing to challenge them in spreading wrong messages? Faith leaders should be accountable to one another. So yes, your thoughts on that, Pastor Max?
Thank you, ma. Sorry, I couldn't show my face because Amazon did not deliver my makeup in time. So I couldn't put my makeup on. So I'm so sorry about that. Okay. Listen, I'm a realist, and I'm one person that I am not scared to voice out my opinions. And me as a person, I have had this debate with a lot of pastors and a lot of my friends. And on my Facebook, I try to send messages out to people regarding taking these vaccines. Now, the thing is this: if I were the government, I think all the pastors, ministers, the GOs that are preaching against the vaccine, I will get every single one of them arrested. And that is the honest truth. I will have got them arrested. And the thing is this, when we have a situation that we have millions of people, or getting to millions now, that have lost their lives regarding this dreadful virus, and scientists are running helter and skelter to put things together so as to minimize the death. And you have influencers, people that have been placed in a position of power to speak the truth to the life of others as to stop this death going on. And they've come to preach against it and say, you know what, don't take it, because they are trying to get rid of the Black community. Now, I don't think America, England, rather the first world countries will want to lose their economy just to get rid of Blacks. So to me, I look at the things that they say on the pulpit that does not make sense at all. So, but for the position that I am, I'm able to speak to people, and I'm able to use my platform on social media to address a lot of all these false teachings. Because as far as I'm concerned, it is, how am I going to put it? I'll title it capital rubbish. And Pastor James said something earlier on, and I'm just going to tap into it. And because I know him very well, he's somebody that I know that he would take his eyes out to help anybody out. So the thing is this: when we have leaders that are preaching heresy, preachers that themselves will come over and will take the vaccine and will go back and tell their congregations not to take the vaccine. Now, the thing is this: the congregation, if you are not exposed, what I mean by that is, if you don't do your own diggings, if you don't listen to news, you don't read, you don't seek information, then people will rub salt in your eyes. And again, they come to tell us that prayer is the key to destroying COVID-19. Well, prayer is not everything. Why are the faith leaders not preaching and telling us that God that created the scientists gave them the knowledge as well to be able to get the vaccine out, so as for us to be able to take the vaccine, so as for us not to die? We are of the same souls. So the only thing that I can do with my own position is to use my own platform, get the messages out, and tell it. I've actually convinced a lot of my friends to take it, and a lot of them, they have taken it. The church where I minister, practically everybody has taken the vaccine, and they've taken the second dose of the vaccine as well. So the position that I am, that's the only platform I can use. And I think I am using it very, very well to let people understand that it is safe to take it, and the virus is not created to destroy the Black ethnicity. It is something that happened, and whatever way that it happened, it's affecting everyone. All that have died, they are not Blacks. There are white people that have died, there are Hispanics that have died, there are green people that have died, there are red people that have died. Whatever people that they are, the virus don't know where they come from. So that's what I, as a person, have been doing. And I think the government, if I can see Boris Johnson today, or I can be able to address the parliament, I will tell them that all these faith leaders that are preaching against it, me as a person, if I were the president or the prime minister, I'm telling you today, it would take me nothing to arrest every single one of them, and I will put them in jail. Thank you.
So yeah, before we move on to our next speaker, we have a question that I think is quite appropriate to ask now. And I think, Winston, you may be the person for this one. The question is, why can't we build up our own antibodies for the coronavirus? Or can we?
Well, do you mean by getting yourself infected without having to? Well, effectively, that's what the vaccination does. It allows you to build up the antibodies against the virus without the pathogenicity of the virus. That's the whole idea of vaccination. You either weaken the virus. That's how it was done historically. People got weakened viruses or killed viruses or bits of viruses, and so they weren't able to grow and multiply in your bodies. So the answer is yes. That's exactly what we're doing. We're building up our own antibodies. But with the vaccine, there's no danger of the virus going wild inside your body, if you like, because that's what happens when you're infected naturally with COVID. There's a race on between your body protecting yourself from the virus and the virus growing and multiplying and damaging your tissues and organs. But when you have a vaccine, you take away the danger of the virus doing you harm, but you get the same immunity over the long period of time. I hope that's what the question was about. Yeah, so effectively, that's what a vaccine does. It allows you to build up your own antibodies.
Thank you, Winston. We have one more question in the chat, which is in regards to faith, going back to our faith conversation. We'll ask that, and then we'll have some closing comments if there are any, and continue. Thank you. So the last question or comment is to our faith. One of the reasons the vaccine hesitancy in the African community is the religious aspect of the chip and pin, with people saying that it's the mark of the Antichrist. Therefore, some people refuse to take it for this reason. How are religious leaders dissuading people's thinking about this conspiracy theory? Sorry, rather a bit of a mouthful there. I hope that was quite clear. Would any of our pastors like to respond?
Pastor Joshua, do you want to start? And Pastor Maxwell, I'm happy to contribute as well.
Yes, I can say something. Yeah, thank you.
Thank you. Please go ahead.
Yeah, listen, I've always I've had this debate with a lot of people. I don't know how a physical thing can be of a spiritual thing. If you're telling us that the vaccine is a mark of the Antichrist, how can the mark of the Antichrist be a physical mark? How can vaccine interfere or control the spiritual? Come on. They're two different things. And even if you're telling us that it is a mark of the Antichrist, we already have the mark of the Antichrist operating. It's all in the Bible. And God himself put mark on his own people. So how can just people vaccinating me now control my spirituality, or rather make me to become initiated and become the servant of the devil? It's all rubbish. The two don't link up. They don't link up at all. So they can only give this message, this message or messages to people that do not understand, one, the scripture, and two, the difference between the physical and the spiritual realm. If you don't understand it, then you will fall into their hands. That's my own contribution. Thank you.
Pastor Joshua?
Thank you very much. From a theological and a biblical point of view, it is heretical, it is uncultured, unmannered, and unethical for anybody, regardless of their status, positions in society and community, and society at large. God, as I believe, is the giver of life. And that God has endowed humanity with talents, with gifting, with ability, and even these skills, knowledge and understanding. And if we have crisis as this COVID-19, which is not the first time, which is not the second time, even historically, it has been proved that every 100 years and so on and so forth like that, there are epidemic, pandemic, health crisis that affect the global village. But to me, I remember during this time last year, when few people talked to me about these issues, my prayer at that time, and my prayer that I encourage people to pray, is to wish the scientists, those who are in the medical fields, wisdom, insight, and understanding to develop vaccination, because that's the only way. That is the shortest way to manage pandemic. So for anyone, regardless of the denominational and faith background, to condemn what is rightly good. If we say vaccination against COVID-19 is not good, why? Who are the people who developed paracetamol? Who are the people that develop those flu medications? And it works. So it is not biblical, it is not ethical, and it's not right for anyone to kick or to speak against encouraging the vaccine or the jabs against COVID-19. So I don't know where they get their theological training, and I don't know the biblical facts to prove it. And this has no connection with even the eschatology, the study of the end time, as spoken through the book of Daniel, Matthew, and the Revelations. The Antichrist words has not yet happened. We are not even theologically and biblically, we are not in the time of Antichrist. So for somebody to now say that vaccination will give somebody the mark of Antichrist, it is fallacy, and it's a crime against humanity. And so, but the best way we cannot continue to be laying emphasis about what people say. What we should do is to mobilize and to encourage and to speak the truth, how to build the moral standard and how to empower people to have the understanding of the importance of the vaccination. So the same fear, in conclusion from my own side, the same fear we have for other crises of sicknesses, of disease, is the same fear that we must have for COVID-19. So there is a way of saying that the fear of God is the beginning of wisdom, which I also believe strongly. But likewise, the damage of this COVID-19 require wisdom and honesty in all spheres of our society. So what we need to do is not to be bothered about what someone said, and because we cannot be fighting. Those who said those things are not the problem, main issues we have. The main issue we have in our society and our COVID-19 community is to get rid of COVID-19. And the best way to do it is to inform, to enlighten, and to encourage people through information, social medias, and all other means that we can pass the message across. Thank you.
Well, can I come into Brenda? So, okay, well, the fact of the matter is about these leaders wanting to be controlling, QED. Take a look at all of those people that are propagating, that are speaking against vaccination. They probably call themselves healing ministers. And one of the things that religion sometimes unfortunately do is it controls. But when you know the truth, that truth that you know sets you free. One thing I do, whenever, I haven't, thank God, I haven't been to the GP for in a while, but when I'm going, I'll pray. I'm going to see this GP. Lord, please reveal what is wrong with me to him. Give him the ability to prescribe the right medicine. And I always get it. Because one of the things that baffles me about this vaccination misinformation is that people, because they trust us, because they rely on the information that we give, on our ability to speak to them. Yes, God still answers prayer. I know that. I have no doubt, no single doubt about that. But typically, Jesus Christ uses all manners of method or ways to heal. To some, he will say, wash your face. To some, he will say, rise up. To some, he will say, take your mat and walk. To some, he will say, go there, go to that river, go there, because that is where the healing is. But unfortunately, some of these leaders, they are misleading their congregants. And because the truth is, there are so many lazy followers now. Because they only rely on someone else. They are not like that church that goes back to study what they have been told. A lot of them hold on to the leadership. They say, yes, because my leader has said this and it is true. And unfortunately, because of our religious perspective, we are so gullible.
I'm sorry, yes. I'm very sorry to interrupt you. I'm just conscious of time. We have had a very long evening, and I'm sure our panel and our participants have enjoyed this evening. It's been so informative. I want to thank our panel members so much for their input tonight and the responses to the questions. I hope those of you that have been with us tonight have found it informative and useful, and will share the information that you've heard tonight with your family, friends, congregations, etc. We are happy to continue hosting similar events. If you're interested in doing another similar event for our community, please do get in touch. If you're also interested in helping us roll out the vaccination, please contact me. We are constantly looking for community venues to hold our pop-up clinics, to have mobile testing units, whatever works and helps us to reach the community. We are happy and willing and able to work with everybody to make this happen. So yes, my details are in the chat, so please do email me. But again, thank you all very, very much for this evening, for all your contributions. And hopefully we're one step closer to getting the community vaccinated. Just asking, is anybody from the panel any closing comments they'd like to add? Okay, lovely. Well, thank you again, everybody. Please do go and enjoy the rest of your evening, and please do contact me, as I say, with any further questions or possibilities of us working together. Have a good evening, everyone. Thank you all very much.
Thank you so much. Thank you, everybody.
Thank you.
Thank you. Thank you. Thank you. Good night.
Thank you.